Takes to protect your child. Get your child vaccinated before school starts. Immunizations are required to attend childcare, pre-K, public, and private schools. Contact your child's healthcare provider or a health clinic to make an appointment today. To find a provider, scan the QR code for a directory or visit www.mendocinocounty.org/health provider list. A message from Mendocino County Public Health.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants,
which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
All right, good afternoon, everybody. Welcome to the Friday update with Mendocino County Public Health. As always, we're really happy to have our health officer, Dr. Andy Coren, here with us. We'll get some of the latest updates about COVID and monkeypox, etc., from him. And we also have some special guests from our Healthy Families Mendocino program as well. So we're really excited to get some updates and kind of hear what's happening from their program. My name is Cameron Brown, and for today's schedule, we'll get the updates first. Then we'll jump into the question and answer session with the local media. And then we'll also look for questions from the public on Facebook and YouTube live stream. So let's get started. Dr. Coren, I'll hand things over to you.
Thank you. Hello. We're finally seeing a decline in the case and hospitalization rates in California and in Mendocino County. As you can see on this slide, we're seeing all of the modelers agree that we're sort of showing a decline, which is good. Mendocino County is still in the highest transmission level group, but we have gotten back into the medium community level. So that's an excellent progress that we're seeing. The dominant variants now are BA5 and to a lesser extent BA4, which together account for over 95% of cases in California. BA 4.6, which is the little blue line between the light and the dark green bars, BA 4.6 has been identified as a new variant of concern with a slight growth advantage and suspicious for increasing immune escape. Mendocino County data shows as of August 16th, 2 days ago, or 3 days ago, test positivity is down to 9.5%, while the state is at 11.4%. Daily new cases now are a little less than 19 per 100,000 per day. Hospitalizations currently are 2 people in Mendocino County hospitals. Mendocino County residents who have died now account for 134 people throughout the term of the entire pandemic. We currently have 4 outbreaks. Schools have reported 15 cases over the last 2 weeks. All were found before school entry, and the students are all being encouraged to test before they return to school this week and next. Vaccines are still the most effective public health response. There have unfortunately been a very low uptake in children from 5 to 11, and even less in the new vaccines released for the children 6 months to 5 years old. And this is a concern that we all have. Boosters for the COVID for all the rest of us are expected before October, and they're expected to target not only the original variety of COVID, which we have now, but also the Omicron variety, the BA4-5 we're hoping for. And the recommendation, however, is for anyone who's eligible now, not to wait for the new boosters, but get your boosters now. I'm going to move on to Mpox. We are now calling it Mpox rather than monkeypox. It really has very little to do with monkeys, though early in the discovery of this new disease, it did appear in monkeys in Central Africa. We are now seeing over 32,000 cases worldwide. That's outside of Central Africa. In California, they've identified 1,942 cases, which is a rate of 4.8 per 100,000 population. 6 people have been hospitalized in California. 4 children have been diagnosed with the disease. There have been no deaths. Only 1 case has been confirmed in Northern California. That was Humboldt County earlier this week. And none have been confirmed or suspected in Mendocino County at this point. It's important to understand that this is not a sexually transmitted disease. It is not a disease restricted to the LGBTQ plus community. It is passed by skin-to-skin contact with a monkeypox lesion or contact with infected objects, such as linens or clothes, and it may spread with large droplets in a face-to-face conversation with someone or with certain medical procedures that can aerosolize the contents of a pustule. At this time, vaccines, Jynneos and ACAM, are approved for smallpox, and they've been given emergency use authorization for Mpox. They're scarce, but they are available, and this is very much contrast for the early days of COVID. They're available for people who are determined to be very high risk by their providers. Mendocino County has received some for the highest risk individuals. This week, the CDC and CDPH have expanded the availability of the vaccines by recommending for most people a smaller dose of the vaccine intradermally, like a TB test, rather than subcutaneously. And these achieve the same high levels of immunity as sub-Q administration. Cases will be isolated, if they're actual cases, until all the lesions are healed and only new skin is covering any lesions. This usually takes between 3 and 4 weeks. Asymptomatic contacts do not have to quarantine these people who are close contacts, but they'll be asked to do a self-monitoring check daily for 21 days. They should be looking for lesions, of course, but also fevers or lymph gland swelling or other flu-like syndrome symptoms should be reported to their provider. There is also available now a medication for patients with a very severe rash. And we have not received any of the medications in Mendocino County yet due to its scarcity, and the state is reassessing all of the requests. Other vaccines I want to move to. I want you to remember that the flu season will be upon us very soon, and we want people to get the vaccines for that. Everyone older than 6 months old is eligible for a flu vaccine. They are able to be given alongside at the same time as the new COVID boosters. We want to encourage everyone to get these at your provider, pharmacy, or through the Department of Public Health. These vaccines can be administered at the same appointment. Note that there's recent news of a polio case in an unvaccinated young man in New York City who is now permanently paralyzed. This was entirely preventable with a vaccine. This was also the first case in a decade that we have had any in the United States. So this should be a warning. Many children have fallen behind in required and recommended vaccines during the last 2 years of the pandemic, making those children even more vulnerable to many vaccine preventable diseases. Yet many people and parents think that these vaccine preventable diseases are, oh, they're no big deal, either because they had a mild form themselves or because they've never seen a case. But vaccines for measles, mumps, rubella, varicella, or chickenpox prevent many cases of deafness, meningitis, sterility, miscarriages, malformations, and death. Vaccines for tetanus, diphtheria, and pertussis, DPT, and polio prevent paralysis and death. Let's not leave out COVID, which has been among the top 10 causes of childhood deaths in the United States for 2 years now. So these are a big deal if it happens to you or your child. All these vaccines have been proven very safe and very effective, but only if our children get them. So public health is encouraging parents of children to visit their providers for routine well child care and vaccines. Today, the Department of Public Health is actually having a special clinic at Pomalito Middle School here in Ukiah between 2 and 6 p.m. to help 7th graders get their required vaccines to enter. And that includes the DTP and varicella vaccines. So in summary, public health is struggling on many fronts. The new threat of Mpox, which we contain to prevent it from becoming endemic here. Anyone concerned about a contact, call your provider or call our call center at 472-2759. We are now seeing a decline in the COVID cases and hospitalizations, but we must be prepared for future surges. So all eligible should be getting the new booster vaccines, which are on their way, and you'll hear about when they're actually available, when they become available. The annual influenza season is also soon to be upon us, and though it accounts for a quarter to a half of the deaths we've seen each year from COVID, all of us should plan to get our flu shots. And we must continue to protect our children with their childhood vaccines. And with that, I'll end my presentation, and I think we'll move on to Lisa Frederickson.
Thank you, Dr. Coren, for the updates. And as you mentioned, we have Lisa Frederickson and Monica Gonzalez from the Healthy Families Mendocino County program. And we'll hear kind of all about what's happening from them. So I'll hand it over to you, Lisa. Thank you.
Lisa, you have to unmute.
Thank you, Dr. Coren. Thank you, Cameron. I'm happy to be here with my colleague, Monica. We are part of public health nursing, and we're with the Healthy Families Mendocino home visiting program. I have a little slideshow that Cameron will pop up for you, and we're going to try and leave some room for questions as well. So my name's Lisa. I'm happy to talk with anyone at great length about our home visiting programs because they're really, really important. I'm glad to have this opportunity. You can go to the next slide, Cameron. So here at Public Health and for Healthy Families, we believe early nurturing relationships are the foundation for healthy development. And the thing that we do is a local adaptation of a national program called Healthy Families America, that has shown really sustained positive impact for families who are new parents, the folks who are pregnant and who are parenting children up to age 3 or 5. The thing that we do is we stick with an evidence-based program that's been reviewed by 35 peer-reviewed articles, 14 randomized trials, and has been improving over 30 years of research and applications. So what that means basically is that we know what we're doing is going to have positive impact across all cohorts, all racial cohorts, and we can expand future opportunities for economic and personal and family development. And we really are able to know that we're going to increase the likelihood that families are going to be able to exit poverty and find ways to become the parents and the family that they want to be. And you can go to the next slide, Cameron. Thank you. So the program is known to reduce incidents of child abuse and neglect because of 3 really important components of the program. It's trauma-informed, it's reflective, and it has a 2-generation approach. So what that means, trauma-informed means that we acknowledge that care teams have to have a really complete picture of a patient's life situation, both the past and the present, in order to provide really effective support and services. We know from studies that were done from 95 to 97 for about 17,000 individuals through Kaiser Permanente that people who had traumatic childhood events really showed poor health outcomes over time in areas like heart disease, substance use disorder. There were higher rates of interpersonal violence, generational child abuse and neglect. So many things that suddenly people started realizing you don't say what's wrong with you, you say what happened to you? How did you get to this point? We know that if we can realize the impact that trauma has on people's lives, we could recognize those signs and symptoms, and we can kind of integrate that into the way we work with people and avoid re-traumatization, reflect on folks' lives in a really even way with them, and take a kind of 2-generational approach so that their experience of childhood is something that does not have to continue in their own children's lives. You can go on to the next slide, Cameron. Thank you. So when we say reflective, you know, what that means is it's that whole person approach. We go in and we do really in-depth assessments. We talk to people about their lives, their experiences, their childhood, their hopes, their dreams, their resilience, how they got through tough times, how they see their future. And we go in and use a technique called motivational interviewing, which allows us to allow people to say, I hear you, I see you, I'm with you, this is a safe place, and think about the way that change in behavior and change in people's lives can be motivated by situations of trust and situations of self-regulation, calm, and support. We do in-depth assessments for child development, depression screening, and follow up with referrals to services to help people reframe and pull away from what might have been a kind of internalized bias or low self-esteem that has been reinforced through their lives. It's a way of having somebody who says, I'm going to ride along with you. I understand what you can do and what you will do. Go ahead, Cameron. So again, I just want to really emphasize how important that two-generational approach is. We often go into homes where people have significant history of their own adverse childhood events, which could include things like abuse, neglect, divorce, a parent incarcerated, um, witnessing violence between parents. And often what happens is the ability to form a trusting bond, to form an attached and trusting bond, has been really eroded and degraded over time. The effects of childhood trauma affect the nervous system, they affect the brain, they affect brain development. If somebody is saying to you in a really angry voice, "What did I tell you? What did I tell you?" Your frontal lobe, your frontal cortex, it won't work. It doesn't work. And so you actually close down, and that nervous system response becomes habituated. And so by building trust, by working around these elements of nurturing and attachment, knowledge of parenting skills, parental resilience, social connections, and concrete support in times of need, as well as social and emotional competence of children. Those are elements that the program builds and uses to break those ties to generational trauma and move a family ahead. You can go to the next slide, Cameron. So our team provides supportive home visits for families from pregnancy through age 5. And since we started in November of 2017, 196 families have been participating in this free voluntary program. Today, we have 5 home visitors, and we reach 51 families throughout the county from Covelo to Wallala. And the visits are going to take place really anywhere those parents or caregivers want to meet us. Some people don't have a home for home visiting, right? So we'll meet in vans or libraries or cafes. Some people may be in a domestic situation where they're fearful of a partner and they need support outside of the home to think through their situation. So we'll go and we'll meet people wherever they are, all throughout the county. And given the geographic challenges and diversity of Mendocino County, living in a rural area, the fact that our staff are able to reach them pretty much almost anywhere in the county is just a wonderful thing. Okay, Cameron, what's up next? So what we'll do is we'll have nurses and community health service specialists who get a call, get a referral, and they're going to call up a family at a pretty early age, hopefully prenatally or within the first 3 months of birth. For some families, it'll be up to 24 months, and offer them these services, which are flexible, could be by phone, in person, or at Zoom. Usually people like to meet in person, and we actually have continued to meet people in a safe and distanced face-to-face way all through the pandemic, which is a real testament to the dedication of our home visitors. We'll meet for an hour to an hour and a half, once a week to once a month, depending on the family's needs. And we can continue those visits up until the time the child is 5 years old. So we're riding alongside them through really critical developmental stages, assessing development and need along the way, helping people who are under sometimes very stressful situations learn to handle the stress of the terrible twos, getting teeth, learning to walk. When people are living under conditions of stress and pressure, that's when they most need the support to self-regulate and and learn to relax and really truly enjoy the very brief time we have with young children as our kids, right? So parenting education is one of the things we do. It sounds kind of dry, but it's actually a lot of fun, a lot of games, a lot of playing, a lot of encouraging people who don't have a lot of opportunity for play in their lives to let down their defenses and relax and really play. They may not have had that experience themselves as a child. They may not have had somebody who knows how to have eye contact, how to have a conversation, how to have a laugh. They're kind of learning, some people are learning that. And the other thing we'll do is work with the families on family goal planning. Think about, okay, well, you're living on this couch now, or you have this apartment now, or you want to go back to school, or what's your next step? What's your goal? What are you hoping for? We don't impose anything on families. We truly listen and try to support, what they want, what they think their life wants to be. Got another slide for me, Cameron? So the connections that we build with people are really, really the center of it. The staff is specially trained to support families through ongoing training that includes things like cultural awareness or child development or anti-bias training. And they'll continue to meet weekly with their supervisor for special reflective supervision to learn to deal with the triggers, frustrations, bias, and need for professional boundaries that sometimes comes with working with families out in the field. We get our referrals from clinics, hospitals, providers. People can refer themselves. And the most important thing we offer is this really direct one-to-one contact that is really tailored to each family's needs. So in 2020, Mendocino County Healthy Families was one of only 11 statewide counties to be awarded a three-year funding to innovate outreach strategies to rural Latino women and their families. And you have a picture there of Gabriela, Mariana, and Monica, a bilingual team. You'll be able to talk to Monica as soon as I relinquish all this talking to her as well. And the thing that's wonderful about this team is they bring lived experience, and they bring empathy, and they bring a wide variety of experiences. And Gabriela's been with the county almost 30 years. Monica has just started with the county. So we kind of span a spectrum of what the county brings and can bring to our neighbors, our community. We can go to the next slide, please. So it's important to note that the benefits of the program accrue not only to the families, but to all of us as taxpayers, as fellow citizens, as neighbors. The return on investment for each dollar spent on a home visiting program like this is $1.46. When it's a family that has been involved in child welfare, that return is even higher at $3.16 for every dollar. Interestingly, families with boys show a higher return of investment as well, most likely because of the higher rates of incarceration. So it's something that is one more aspect of the benefits of a program like this. Could you go to the next slide, please, Cameron? So this is another breakdown of some of the benefits. We see that, there's a 41% reduction in alcohol use. There's other cost benefits. There's an increased awareness and reduction in maternal depression, which has been a huge issue for our county since the pandemic. the thing to remember is that we ourselves as home visitors or as taxpayers won't necessarily see these effects immediately because it's an evidence-based program that it occurs over time. We know we make a difference. We won't necessarily see the direct outcome. You know, I can work with the family and I can say goodbye to them after we've been with them, and I can, know that the benefit will be there down the line because this is a lifetime impact and it's a multi-generational impact. So you can go to the next slide, Cameron. This is our team. We just went through a pretty rigorous accreditation, which means that we had to follow 154 best practice standards that have been established within this evidence base. We know that if we can follow with fidelity to this model, as I said, we're guaranteed these positive outcomes. And it was a big deal to go through it. We passed, and we passed with flying colors, and we're really proud of all of the work that everyone on the team has done. I can't tell you how kind and dedicated and hardworking this team is. They are ready and willing to ride the bus, sit alongside the people who really need them, and the trust and the bonds that are formed are quite remarkable, really amazing. You can go to the next slide, Cameron. This is a quote from one of our moms. And it is really true. I mean, there's huge impacts, and I'm so glad I had an opportunity, and we've had an opportunity to share a little bit about our program with you. And with that, maybe we could pop out, and feel free to call this number, email us. I'd be happy to tell you more anytime. My name is Lisa Frederickson, and we're about to be joined by home visitor and community health service specialist, Monica Gonzalez.
Thank you, Lisa. Good afternoon, everyone. My name is Mónica González. Buenas tardes. Bienvenidos a todos. And I'm so happy to be here today because I'm a new home visitor with Mendocino County. And it has been such a great experience in this past 7 months that I've been working with families. Like Lisa said, this is a long-term program, but I focus on the Latino population. And with this short time doing visits, I've learned so much, all the challenges that these families are facing. And as a Latina, I can understand what's going on with them. And I'm just going to give some of the examples. I have families that don't have vehicles to get to appointments. I have families who are very afraid to go to clinics because of the public charge. And all of this is affecting their children. So when I have the opportunity to go to these homes, it breaks my heart. It breaks my heart to see that we need to have more information out there, and it's affecting the children. But slowly, I have the opportunity to educate these families. Besides the curriculum, I can listen to what they're going through, to their fears, to their goals. And I'm advocating for these families, but I'm also teaching them and helping them navigate the system. Because what I want to do, use a lot the parallel process in this program. I'm showing them how to continue with their lives. I want them to feel independent. I want them to feel that we have a lot of opportunities here and that our children are our future. So, like I said, I feel very grateful with my team because I have been learning a lot, but I've been learning a lot from these families as well. And please feel free to ask me any questions.
Thanks, Monica, and thanks, Lisa. So yeah, let's jump right into questions. So for the format today, we'll go one media outlet, one question per round. So hopefully we can get through 3 rounds of questions for each media outlet, and also some questions from the public as well that I'm seeing. So let's start with Danila with Mendocino Action News.
Thank you, Danila Sands. Thanks for having this meeting and including so much other information as well as COVID. I guess my question would be about, was it Mendocino families, how to access that information, either online or in person, to get more information for the public.
Hi, Daniela, you can go to the Mendocino County Public Health website. We have a page there that has information about our program. You could also email us at healthyfamilies@mendocinocounty.org. And our phone number is 707-472-2757. But I'd direct you to our page on the public health site.
Thank you for that information.
Sure.
Okay, thank you, Mendocino Action News. And let's have Lucy with Mendocino Voice.
Awesome. Thank you for being here today and giving us some great information. My question is for Dr. Coren. Approximately how many vaccines does Mendocino County have for monkeypox? Is there a lot? Can a lot of people access them? What is that looking like?
So at this point, the state has distributed the vaccines by allotment to counties that have had monkeypox, or they've used as a surrogate for monkeypox people who are at risk. And so the counties that have received regular allotments are in the Bay Area, Sacramento, and Southern California. We did not receive an actual allotment. However, we reached out to our providers in our rural and federally qualified clinics and asked them the question, who do they think are the most at risk, who are severely immune compromised and may still be active in the communities most affected, and got a number from them, and we requested that from the state. And so we got an allotment of 35 vials initially, and those have been distributed. We still have some left over. And so I think we have in the range of 50 more vaccines to be used. At this point, we're only using them for people who've had a very close exposure, or again, these people are very high risk because they're immune compromised. But if we have a case of Mpox, then we'll also want to do some contact investigation, contact tracing. So it's good that we have some left over. And we sort of lucked out because we only had 10 vials left from the original allotment that we got from CDPH, but it turned into 50 vaccines because of the change recently in administering the vaccine. Instead of a half a cc or 5 mLs, I'm sorry, a half an ml or one subcutaneous vaccine became 5 intradermal vaccines. Does that answer your question?
Yes, it does. Thank you so much.
Okay.
Okay, thank you, Mendocino Voice. And then let's move on to Susan with Independent Coast Observer. Susan, you might be on mute if you're talking.
You're unmuted. Oh, sorry, having technical problems as usual. Wanting to ask Dr. Coren about this recent article in the LA Times. It said Mendocino County was one of 10 counties in the state that it has fewer than 93% of the children vaccinated against polio. And I was curious, is the number, what percent does Mendocino County have? Do we
You
have?
know, oh, I'm sorry. Go ahead. I interrupted you. Susan,
No,
go
you
ahead.
didn't.
Okay. All right. So that is based on data that I think is the latest data from before the pandemic, and it was low. And our county does have a deficiency in children who are generally vaccinated. I think that also, and I read, but I don't remember all the details. I think that was not the school entry number, but the 2-year-olds who should have been fully vaccinated against polio, at least up to that age, were not. And our largest proportion of children are in partnership health plan, and we're working with them in the clinics to find out how significant that is for the children entering school. And that's one of the reasons why public health is collaborating with the clinics and having these catch-up vaccine events. We only have one event at this point scheduled, and it's at Pomalita today for the children who need vaccines to get into 7th grade. But there may be others. At this point, we think that the clinics are probably doing what they can, and that we're higher than that by the time kids get to school. But it is a problem. I mean, there's no question that Mendocino County needs to catch up on all of our childhood vaccines. Polio is just one of the marker vaccines that we're all, of course, terrified by, and that number was looked for because of this case that was found in New York. And the feeling in New York is that that's only one of many others. They're actually seeing it in that area in wastewater surveillance. So we know that there has been a deficiency in getting children up to date on their vaccines.
Thank you.
Thank you, Independent Coast Observer. And let's get a question in from the public now. This looks like it's for Monica or Lisa, asking, do you work in coordination with social services?
Monica, do you want to talk about referrals that we make?
Yes, so we do. And so we try to work in partnership with all the agencies in Mendocino County. So depending on the family needs, we get their permission, and we have a signed consent, and we do work with the other agencies.
And I would add, we do get some referrals from Family Children's Services. We get referrals from other social service agencies like CalWorks as well. And I should put a plug in. We also encourage families to keep up to date with immunizations, and we support that with it for families as well.
So I just wanted to point out that in many countries, there's home visiting automatically, and it's universal. And that would certainly be our goal here in Mendocino County. And as a matter of fact, we're looking at other funding sources right now to see how much more we can expand home visiting. For example, in England, I know that regardless of income, because income does not necessarily determine how comfortable you are coming home with a new baby, you get 3 visits. And sometimes the home visitor might just hold your baby while you take a shower. And sometimes they're teaching you how to coo and respond and make eye contact. Sometimes they're teaching you how to swaddle. Now, our program is not just for newborns, like in some countries. Our program goes prenatal to 3, but we are looking to see how universal we can make it. And less than a third of the families we visit with are in the child welfare system. So the great majority are not in a child welfare system. They just want to improve their parenting and feel more connected to their child and their community.
All right, thank you, Lisa, Monica, and Anne for that great explanation.
Cameron, excuse me. I want to go back to Susan's question because I just pulled out the article and made a mistake in my response. So the article actually says that in California, we are one of the 10 counties that in 2019 to 2020, fewer than 93% of the incoming kindergartners had been fully vaccinated. And so, and that was vaccinated against polio. So that is a very big deficiency. And it is from 2019 to 2020. But we're looking to develop those statistics now. I've requested them. We don't have them yet.
Thanks.
Yeah, sorry I made that mistake.
All right, let's start round two. So back to you, Danila, with Mendocino Action News.
I'm going to pass at this time. I no longer have questions, but thank you for the meeting.
All right, so let's have Lucy with Mendocino Voice.
My question is, what is the plan, when school starts, if monkeypox starts spreading? Is there any caution that parents are given? What's that going to look like when school gets started?
So that is a very good question. And let me just say that the California Department of Public Health is actually working on recommendations. Please understand that it is still a very rare disease and certainly has not happened very significantly among children. But what we do want to make sure that people understand is that if they do have the lesions, they are contagious. And if they have any of the prodromal syndromes or symptoms, and they have had close contact with people who have monkeypox, then they need to be seen by their providers. At this point, if a child was found to have monkeypox lesion in school, they would be asked to isolate just like anyone else would. But for any child, for example, who might be in a home or have close contact with somebody who does have monkeypox, there's no quarantine that's needed. So it's a very different situation with monkeypox, which requires direct contact with a lesion compared to COVID, which I think we're all worried about. Do we have to close schools and all that? It's not something that passes nearly as easily. And so public health officials are working on some advice that will be apropos to schools, but it certainly isn't a reason for us to be terribly frightened about what would happen in the schools.
Great, thank you.
Thank you, Mendocino Voice. And back to you, Susan, Independent Coast Observer.
Hi. Back to this New York article about the fellow catching polio and becoming paralyzed. Some time ago, there was discussion about doing wastewater testing in Mendocino County. I would assume that would occur only in places with wastewater treatment plants like Ukiah, Fort Bragg, Willits, or incorporated cities. I just wondered, has anything moved forward with that? Is anything happening, or is that still long in the future?
So there was an interest by the city of Ukiah, but there's also an expense. And so far, they have not gotten that program up and running. We do have wastewater surveillance happening in 3 counties in Northern California: Humboldt County, Shasta County, and Lake County. But we do not have any yet here in Mendocino County.
So in terms of the expense, is there funding available to cover that for Ukiah?
There was some availability of the testing equipment, but the actual, I'm not aware of any grants or availability to fund the actual testing by the personnel themselves. And the lab tests are actually very expensive, and some of that was supplemented. I don't know if those are still being supplemented at the same amount.
Mm. Thank you.
Thank you, Independent Coast Observer. So we can go into round 3 of questions. And back to you, Mendocino Voice, if you have any more.
I do not have any more questions. Thanks.
Okay. And it sounds like Mendocino Action News had no more questions. So Susan, back to you if you have any more.
I just wanted to know how prepared we are at this point in terms of COVID and kids going back to school. Is it a highly confident foot we're putting forward, or cautiously optimistic, or what would you say? How would you rate it?
It depends on what side of the bed I've woken up on this morning, but we do have a lot of layers still in place. So remember that over the summer, we have helped various different schools improve their ventilation, which should really help in terms of keeping this aerosolized and airborne virus out of the air. The teachers and the children have certainly learned a lot about changes in their behavior and spacing, although social distancing is less emphasized than ventilation now. As you know, masks has been made not mandatory, but highly recommended. And my understanding is that almost no one in the schools, just like if you walk through the streets, very few people are using masks. I think that's a big problem. So there's a vulnerability there that I'd like to see go away. At this point, we don't have new viruses that are spreading rapidly or more virulent on the horizon. We do have this BA 4.6, but variants are going to be happening. So I think that we have less risk, at least in the next month or so. And the main thing that we do have is that we have home testing available, and the children are using that, and the staff are using that, and everybody is really benefiting from that, because when those children are found to have, or the staff are found to have a positive COVID test, they stay away from school. And so they're not likely to pass it on. And then there are evidence-based recommendations about how long to stay on isolation and when to come back after testing to get back. So I think we, as a society, we've learned a lot more. There has been some more investment in ventilation. We have a good future ahead of us. We have more people who are also vaccinated, and that gives a certain amount of immunity. But we are not well vaccinated in the state or in this county for the 5 to 11-year-olds. There's been a hesitancy in taking up those vaccines. And so I wish that we were in better shape there, and I wish that more people would be wearing masks. But I think we'll probably have to wait a little while to see those two things happen, and hopefully it won't take injury on too many people's parts before that happens. And even more hopefully, we won't get to that situation. Maybe we are really seeing a tapering of this COVID pandemic, and it's probably because of what we've learned and the vaccinations and immunity we've already had.
Not to argue, but Manchester School District here on the South Coast, which is a total of one very small elementary school, is requiring masks on everyone for at least the first 2 weeks of school.
Good.
Interesting. We'll have to look at attendance and how many people are out sick and see how that worked out.
And the superintendent, who's new, also said that might extend longer. It will depend on assessment of how things go. But that's radically different from all the other superintendents I talked to.
I think there's another small school that's also doing having masks mandatory initially, at least. My hat's off to them. They're doing what is recommended, and it will hold down, the contagion in their schools. And it's not just the children, but the children's families and the staff. That's why it's recommended.
All right. Well, thanks, everybody. Cameron?
Yeah, I think it's about time to wrap things up here. Almost 3 o'clock. Yeah, so I want to send out a lot of thanks to everyone that listened, asked questions, all of our guests today. We're going to keep going forward with the Media Day on the third Friday of every month. So the next one will be September 16th at 2 p.m. So in the meantime, our Facebook page, our website, mendocinocounty.org/ph. You can find public health updates there. So thanks again and have a great weekend, everybody.
Thanks, Cameron.
Thank you.